I do see it. I see the thing. We'll wait for. Got it. To this. Hello, hello, Facebook world. We are getting on for our Ask and I can't even speak. I'm so nervous for my Facebook audience. We are at Ask an Estill Expert live. That's also a mouthful and a weird. Ask an Estill Expert. Say that 10 times. We are, hopefully you are coming on and you are viewing this live on our Estill Voice Training Facebook page. My name is Luke Steinhauer. I am the Customer Experience Manager at Estill Voice International. We are here with Cari Tellis, who's our admin assistant at Estill Voice International. And the most important guests we have here today are our two incredible Estill mentor and course instructors first, right? This is an Estill voice training page, but two incredible speech language pathologists, to name just one thing that they do. But we have Joanna Lott and Cari Tellis. Joanna Lott is a speech language pathologist, a voice therapist at the University of Virginia, and Cari Tellis is professor, voice therapist at Misericordia University, and they'll get to tell you a little bit more about what they do and where they're at. I want to encourage everybody who is viewing today to ask questions live in the chat. We have people monitoring, and Carter will shout out the questions when we open it up. But I'm going to, at this point, remove the spotlight here and now turn it over to our guests. Let's start with Joanna. Joanna, tell us who you are, what you do, where you're based first.
I'm in Charlottesville, Virginia at the University of Virginia Voice Center. I work with a wonderful team of laryngologists and speech pathologists. Dr. James DeNiro is our director. He's wonderful. Dr. Pat McGarry, Casey Resnick and Flora Vasilev, wonderful speech pathologists that I work with, specializing in voice and swallowing. And I am teaching a voice disorders class for the graduate school this semester for the first time, which I'm thoroughly enjoying. And yeah, that's pretty much where I am and what I do.
Okay, awesome, great. Cari, same question to you.
Hi, and thank you for having me here. It's always just such a pleasure. I love Joanna and Luke and Carter and everyone at Estill. I am a full professor at Misericordia University in the speech language pathology department.
And yeah, that's pretty much where I am and what I do.
Okay, awesome, great. Go ahead, keep going, sorry.
Okay, that was interesting. I've never had that happen, but okay.
I know.
That's just a brand new world, you know, with
I know.
Facebook Lives and Zoom. So professor of speech language pathology, my area and specialty is voice, motor learning, interviewing and counseling. So I do all that. I work in our in-house clinic as a consultant to our students. I have a private practice in our local area where we see a lot of voice clients. We do a full speech pathology caseload, but we really are a specialty clinic for voice. Have great clinicians that work with me, Tia Spagnola, Chantel White Duck, Aaron Roberts, and we work with a lot of the local ENTs in the area. And that's just fascinating work. I love to stay involved clinically. And I'm also the director of a performing arts training academy called Patasphere, where I do vocal coaching and training with mostly young performers. And we're just starting a little program for 4 to 6 year olds, which I'm really excited about beginning. And I direct shows, and it's just a lot of fun. It's kind of my passion.
Awesome, so cool, such well-rounded individuals. I want you both to tell us how you came to Estill Voice Training, just in the first place. Obviously, we know both Joanna and Cari are the highest level of certified in Estill Voice Training, which is Estill mentors and course instructors, which means basically that they are Estill experts and that they've been with the Estill Voice model for quite a long time. But again, how did you find, Joanna, you'll start, how did you find Estill? What drew you to it? All that sort of stuff.
My path, unfortunately, was longer than, or it was, I wish it had started sooner, I should say. I was always a singer and I loved singing. I taught voice. I moved to New York City to be, to become a famous Broadway performer, of course. Um, and then when that didn't actually happen, I happened to meet a voice teacher around the time I was considering leaving New York. His name is Tom Burke, and he is an Estill mentor and course instructor now as well. At the time, he was a master teacher, master trainer, and he started mentoring me. And he said, "Why don't you go to an Estill course?" And I said, "What's Estill?" And he said, "Let's look and see what the next Estill course is, where it is, who's teaching it." And he said, "It's Kim Steinhauer in LA, and you should max your credit cards and go." And I wouldn't have, except that Kim Steinhauer was my band director's wife when I was in high school. And so I recognized her name, and I just felt like it was fate. So I went to the course. I did max my credit cards, and I am probably still paying them off. And it was a game changer. I decided to go into speech pathology. I went to graduate school, and yeah, and then the mentor course instructor part was well worth the work. To me, it felt like it was almost more useful to me than my fellowship was. I mean, my fellowship was very valuable. You get a lot of experience with that. But what I learned and how to apply it to what I do is just, it's just so valuable. And I see it in the patient outcomes.
So incredible. Cari, tell us your journey. I also forgot to say that that band director happens to be my dad. But anyway, I didn't want to chime in. Cari, go ahead. Tell us how you came to Estill.
So I was a graduate student at the University of Pittsburgh in speech pathology. And it was the summer between my grad school 1 and 2 years. We had a summer class in voice disorders. And the professor at the time was on maternity leave. So her doctoral student, who was Kim Steinhauer, ended up teaching the anatomy portion of my voice disorders class. And it was the very first time that anatomy made any sense to me. I was like between grad 1 and 2 years of grad school. So I did my whole undergrad in speech pathology, communication disorders. So it wasn't until that time. And I went up to her after class and I said, "You make so much sense." And she wasn't using Estill terms, but she understood the anatomy and the way that she was describing it and talking about physiology. And I said, "I've always been a singer. I want to learn from you. I've been looking for a voice teacher." And so I went to her class, and Luke was a tiny little guy at the time. He was so cute. And Kim would be like, "Show Cari what you can do." And I was like, okay. It was so cute. And he really was. And he's still phenomenal. But that was my introduction. And actually, Estill was just starting to make training videos. And the videos were on VHS tapes. And Kim, I remember putting it in her VHS recorder, and we watched them together. And so I actually learned Estill through singing, and then started, now this was like 20 years ago. I mean, it was a long time ago. And then started kind of transferring it to clinical practice as I, went into my CF and my externship in CF as a speech pathologist and voice instructor. And it was just kind of grew at that time during my PhD. And I stayed in contact with Kim, and we've always been collaborators in that way. We worked at the UPMC Voice Center together when Kim did singing voice therapy or singing instruction there. And so it's been a long time and a long road, and I love being a part of it.
That's so great. It's not all about me, I promise. So incredible. And I'm going to just get into my first question, and then we do have a question in the chat. But talk about how you integrate Estill voice training, specifically as a speech language pathologist, I guess, as a voice therapist. How are you using it is my first question. Joanna or Cari, you can hop in and answer. Let me pin both of you here.
Okay.
Well, I'll say that I learned Estill as a singer just as Cari did. And then I also was learning about how to be a voice therapist in graduate school and in my fellowship. And none of that, what Estill taught, was applied. And so it was a very confusing thing for me initially until I started having sort of monthly mentoring calls with Kim, and then met Cari finally. She helped mentor me through my EMCI. And since then have had a lot more confidence in it, which is a long way of saying I would like to turn this over to Cari to talk about, because she has basically taught me most of what I know about how to apply it in the clinic.
Oh, well, thank you. And I think it's always a collaborative effort. So I love talking to you about it and bouncing ideas off. It is essential. The Estill model is essential learning for voice therapy. I mean, it's essential learning for voice instruction. I mean, it is the only model that exists that talks about the structure and function of the vocal mechanism in any sort of way that, in any way. It's the only model that exists. So it's incredibly intuitive to then take that model and integrate it into voice therapy instruction, just as if you would take that model and integrate it into singing voice, instruction and coaching. So the only difference really is that you're taking a system in someone with a voice disorder or issue or injury and applying it to an altered functioning system. But really, it is the only model of anatomy and physiology that can be utilized in that way. So it's what we know, like right now. And yes, it's new learning. And I think that's what people kind of get scared about who aren't in the Estill world, because it's newer learning. But we're talking about the same structures. We're calling them the same structures names. We're talking about function in the way that we understand and know at this point. We don't have now. MRI is coming out with some cool things, but we don't have a way to get in there and completely test it. I mean, that's going to come in time, but this is what we know so far. And so to utilize it in that way is so important, and it's necessary. Mm-hmm. It provides our clients with actual tools.
Yeah. Right. And I think that what you said, it's the anatomy and physiology. We're not changing the way voice therapy should be done. We're giving people more tools to work with, because the model is set up in such a way that it's very accessible for the patient, and it's such a great tool for troubleshooting. If you're using a traditional therapy like resonant voice therapy and the patient is stuck, it gives you options to help them get unstuck, and it then helps them become the clinician, which is the ultimate goal, is for them to be able to troubleshoot on their own and to become the clinician, no longer need the voice therapist, and have the tools for different situations. For, if the voice problem gets worse or improves, they can gauge it, turn up the effort, turn down the effort, turn up the anchoring, turn down the anchoring, all of those things. And it just gives you so much more confidence as a clinician, because you have so many more tools to work with than just, oh, they're not getting it, what do I do? They're not getting it, what do I do? And that, in my first 2 years of voice therapy, I did a lot of just repetition and going, I know there's more I could be doing. I just don't have the confidence to bring it in yet. And then finding the confidence through Estill.
Yeah, that's absolutely true.
Yeah, I mean, so true. And again, like you said, nothing we're saying is necessarily not already out there. It's the way that Estill almost packages it. It makes it accessible and easier for clients, students, to understand it, and then give you words then or prompts or whatever to understand it even further. We're going to go to for many questions. We're going to go to the first one that I see, which I think is interesting, and I think it's about the way you approach. How do you use Estill Qualities in your therapy? They say that, a lot of it's easy for the figures, because we can identify structures and help people find them. But how would you use Qualities in your practice?
Qualities are a great place to start with stimulability. If you are trying to trial something out, I think that it's a really good place to start with that. The figures are so integrated within the qualities. It's kind of hard to say which one. Like I'm using just a figure condition because it's so integrated into a quality. But sometimes when somebody, a client's learning and they kind of understand it more conceptually as a whole, and the quality makes more sense to talk about in that way, and breaking it down into component parts makes it a little bit more difficult for like individual figure condition learning. I'll utilize a quality to give it a name. Like we're going to use this like twang,
Right.
and twang's, Joanna wrote a great paper on twang therapy. Like, so if I talk about the quality, it's kind of giving them an overall picture of what I want, when AES narrow seems a little bit too technical for them.
Right.
I use it like that a lot.
Yeah, I use it like that as well. And I think it's also what it sort of shows us when we learn the qualities and how each of them is a recipe with different ingredients. Then when you listen to the patient in the evaluation, you're hearing their current recipe, their attractor states, and then you're determining what new recipe will benefit them. And so you're actually using the Estill model, but sort of making it your own and really individualizing it for the patient. And so it gives you, I'll even put it in a little chart so that I'm like, okay, we're targeting this. Well, wait, what is that? That's twang therapy. Or wait, what is that? That's, sob or whatever else. So, and sometimes if you teach a quality, like Cari said, rather than breaking it down into the figures themselves, there's so much flow on effect from one figure to another that you can be having them tilt their thyroid and it retracts their false vocal folds and vice versa. And so if they're doing the opera quality, they may never sing opera in their lives, and it's not necessarily the only opera way to sing either, right? We know that that's not the way that the Estill model is designed. But now the patient has access to so many new tools, whereas before they maybe came in kind of like, I have a voice disorder. And now they have this whole new posture and understanding of effort. And it's really effective.
Yeah, we're discussing the interaction now of the system, and the qualities provide us with that interaction, especially and more utility to it than sometimes going to each individual figure or a couple figures.
Such a great answer. I want to move to another question here, and I'm going to kind of rephrase it. They're talking about people get into their performance mode. They think, okay, I need to do it immediately, and so then it creates a lot of anxiety. So what is the benefit to essentially focusing on isolations? And again, the way the Estill model teaches, focus on craft. How does that then influence artistry and performance magic?
Well, I'll just take a little lead on this, and then Joanna, I want you to come in on it for sure. But we're talking about brain processing. We're talking about how the brain works. And, you really can't do two things like that at once. You can't be like learning these like individual isolating factors like figure condition and then start to really, put it into your singing if you want to be in performance mode, because if you haven't practiced that over and over and over again, you are going to go into a clumsy type of brain processing, which is type 3 or 4 in like the MAP model for brain processing, where we really want you practicing in type 2 brain processing, which is a type of brain processing where I can focus on the technical aspects of it, and as a coach, as a therapist, like I can really work on those individual isolating factors, like you're calling them. But when you go into performance mode, it's almost like, or you are performing, if you haven't practiced it enough and integrating enough into performance, you kind of get what you get and you don't get upset, until you're able to practice enough to get it into that, or you will choke. And that's why people choke. That's why people like run off stage and have those really traumatic experiences where they don't come back on the performance stage, where they don't get back up and talking in front of people. Like, I can't get you back even to do a public speech, you know? So we're talking about brain processing. It's like a bigger like understanding of motor learning. And it's like, you got to learn, you got to take the time, and you got to practice.
Yeah. And I would add to that, Cari has written a great article about the research she's done on the different brain processing, the different types. And it's, I actually just taught from it in my class last week. So it's right in my brain. And I had a patient yesterday who I'm seeing now once a month for maintenance after a very traumatic injury in a car accident where she had a thyroid cartilage fracture and was trached and all of this. And she leads worship in her church and hasn't been able to return to work. And we're working on getting her back to work. And I hadn't seen her in a month. And she came in, the first thing she said was, so it's pretty much automatic now that I head and neck anchor when I sing. And I think that I'm also thyroid tilting pretty automatically. And I was like, oh my goodness, I didn't do that. You did that because you did the work, right? Yeah, it was so great.
Yeah, and that's why training is so important. You know, it's so important in the voice singing performance world. Like, we've got to train like athletes. And we talk about that at Estill all the time. Like, go to the gym, you go to the voice gym, you have to train, and you can't stop training, because that's how it becomes ideal and automatic. That's how you can get into the zone.
Exactly. Such a great, again, amazing answer. I want to go to, I think, one of my questions first. You are speech language pathologists, you are anatomy and physiology experts, and most SLPs are. There has been, I think, an unfair argument that Estill doesn't go far enough, or it doesn't touch everything. What is your response to that? What can you say about perhaps the more specificity of, if that's even a word, of the model, right? And why that's important?
I'm known for having literally no poker face. So if you saw my reaction as you said that, that's sort of like how I feel.
Yes.
I've never had a more in-depth and accessible tool than this. I'm sure that there are pieces missing because it's such a new science and there's so much we still don't know and we need to work on. And there's more research to be done. But I would just say, tell me what you mean. If someone said that to me, I would say, tell me what you mean, because I'm not quite sure I understand what you feel is missing. I've had people make the argument that it doesn't cover breath support, and it's just not true. It totally does. It covers it as power, torso anchoring, and coordinating the whole system with these different qualities. So I think that I'm always confused by the question. I always want to say, have you been to a course? Because if you haven't been to a course, then maybe you're just making assumptions, or you're just repeating something someone has said to you.
Right.
That's my response. Yeah.
Yeah, and I totally agree with that. And I also would also add on to that, if you don't use Estill, you're missing a whole lot.
Yeah.
Because you don't have access to talk about the way to create these spaces that you're trying to create, or create the sound that you're trying to create. You're talking from a very like kind of abstract auditory perceptual place,
right?
Like only. And so maybe we can meld minds and get something together. Tell me what you think it's missing, and we'll talk about it, and I'll tell you should learn this.
Incredible. I'm going to get to a specific sort of SLP question here. And let's get more specific and granular with the model. So feel free to answer this, as you know, you're a clinician. What approach should I take for patients with breath hoarseness due to vocal cord paralysis? So I would say, I think it's more hoarseness. How would you treat hoarseness due to vocal cord paralysis?
Go ahead, Joanna, you want to
So you
start?
get this question all the time.
I mean, yeah, we do.
Well, it really did. I mean, hoarseness is a very vague.
Right.
We want to get very specific. So, in rewatching actually Cari's Estill presentation from the symposium in preparation for teaching the voice disorders class, it reminded me that you can actually associate certain things like roughness, asthenia, or weakness in the voice to attractor states or to figure conditions. And so if it depends on what you're hearing with the paralysis, is it a unilateral paralysis? Is it a unilateral paresis? How severe is the glottic insufficiency? How big is the gap between the vocal folds? If it's really, really big, we might not be able to do much for it. We can probably optimize what they've got. There's always that as an option. But we're probably going to, hit a barrier and say, this is as far as I can take you. Often with glottic insufficiency, I'm going to dive right in with twang and effort and some head neck anchoring probably, which isn't, I think that's probably where I would start, but you have to listen, you have to really get specific about what you're hearing,
Right.
and what their limitations might be.
Yeah, exactly. I mean, it just you need to know what you're dealing with. I mean, which is part of the issue. And then you do have to understand like the voice science behind what Joanna's talking about. Like, what are the figure conditions that are going to get you medial compression, that are going to get the vocal folds into more of a midline position, and which ones can utilize the longitudinal action and compression to get better closure. So yeah, like thyroid tilt's going to get this kind of closure, AES narrow is going to get more medial closure. What are we going to utilize in combination to make that happen, and what's the effect of targeting the one figure condition that's going to interact with the rest of the system?
Great. Okay, do you ever use sob for weakness or presbyphonia? Am I saying that right?
Oh, presbyphonia. Yep.
Yeah, following up with added twang to AES narrowing after widening, lowering, and reducing vocal fold thickness and loudness. Then notice that the patient isn't able to last as long in a phrase. Does that make sense?
Yeah. Well, for targeting presbyphonia, which is like mutational falsetto, which is when a person goes through like adolescence and their voice, they actually doesn't go through a voice change, and they kind of maintain that childlike.
Wait, are we talking about puberphonia or presbyphonia?
Oh, yeah. Did they say presbyphonia?
Presbyphonia,
Sorry.
yeah.
I heard. You're right. Thank you.
I wasn't sure what I heard either. So presbyphonia, yeah. Go ahead, Cari.
Presbyphonia is like as you grow older, your voice, usually well, in that situation, and there's a lot to it, but you end up with some sort of vocal fold atrophy potentially. So we're not getting vocal fold closure, as well as previously, in their younger years, or it could be an underlying paresis or weakness that's contributing to the decreased closure. I guess the question was, do you use sob?
Sob, yeah.
Yes.
Following up with added twang.
I use what I think will help the client best. So if they have like a maladaptive high laryngeal position, so they're doing like something like that, right? I mean, and I want to get them down to get a lower larynx to get better closure. Like I might do that. I might do like to like get them into like a sob position using glottal onset.
Yeah.
And then add some twang to that, because someone's not going to end up talking like that. So like your target is their voice. You want them to have the voice they want, that they identify with, not the voice you think is their best voice. So I would use sob potentially as a gateway to something else, and then facilitate and work it into being what it sounds like for them. But my target would be get them out of their maladaptive high laryngeal position to a lower laryngeal position to get better closure.
Right, and I totally agree with that answer.
All right, we are almost at time here. I just want to end basically with your Estill inspiration. I mean, I know your big Estill aha moment, essentially. And again, for me, I think it was actually in my mom, Kim Steinhauer's course, it was from the University of Pittsburgh, when there was a woman who used essentially narrow AES and found sort of a more brighter sound, and she could be understood and heard. And that's when I said, okay, this can help anybody, right? Your Estill Inspiration, whatever it may be. We'll start with Joanna.
Well, mine was more personal than clinical.
Cool.
Yeah, it was, although I do know the video, I know the video of the person you're talking about probably,
Yeah.
and that was seeing that in the first Estill course I took, it was all that first week-long Estill level 1, level 2 that I took with Kim in LA. Yet I'm still paying for it. No, I'm just kidding. The course wasn't expensive. The trip was expensive, but was that I have been taught my whole life that belting was dangerous and I shouldn't do it. And I'd had such fear about it. And she taught me the 3 rhythmic out breaths, get rid of all your air, do it. Cricoid tilt, belt. And I belted. And it was, I mean, it still brings tears to my eyes. It was so moving for me. It was so game changing. It was just, letting go of fear is always like that, right? But it just made me, and then kind of turning it around, putting myself in Kim's position, what must that feel like to do that for someone? And I think that's why I was, I had the choice between these 2 roads of continuing to try to teach voice and be a performer, and go to change my whole life and go to grad school and start from scratch. And that's what made me go to grad school. It was that
Incredible.
Yeah.
Okay, Cari, you better beat that, or
I don't know if I can. I was trained classically, whatever that really means right now. But and I wanted to sing the Indigo Girls. I wanted to sing like rock and pop, and I couldn't do it. And I was a student at Penn State, and I was in so many choirs, and I was in a gospel choir. And I remember this guy standing next to me, and I was singing. He's like, "Where did that voice come from?" And I was like, "What do you mean?" I had no idea I could even do what I was doing because I couldn't hear myself. So I was just like going with everybody. And when I met Kim, that's my thing. I said to her, I'm like, I want to sing. Like, I want to know how to do that. And I don't know how to do that. And that then, because I really came to Kim for singing help. And then when I was in my, grad school and then working with my voice clients for the first time, I could mimic things really, really well. Like I could go, or my, oh my, and do all that. And I could get my clients better. But just like what Joanna's saying, it was like, why are they getting better? Like, what does this mean? So my aha was like, when I actually connected those 2, like I connected Estill to all these like implicit facilitator models that I was able to do to help clients, and then to understand why it was working. And then I was just like, oh, that's it. And now it just feels like, duh, like, why didn't you get to that before? But it was like, wow, like that's what I did when I was singing, and that's what I did. And now when I teach these young kids how to do it, and they learn from the beginning how, and they're just like, what do you mean it's something else? Like, what do you mean they talk about something else? And I'm like, they have their aha moment. I don't even know. Do they have an aha? Like, they just know it.
Right.
And it's just the coolest thing.
And I know we're almost out of time, but I just want to say one quick thing. It's really important. We have all mentioned Kim Steinhauer, and she is the inspiration for a lot of the people that do Estill. But I don't want people that are watching this as newcomers to Estill to feel like it's a tight-knit circle that you can't get into, or that it's in some way exclusive. Estill is very accessible, and we are all very accessible people. And it's one of the things I love about this community is that there is nobody that I have run into in this community that I feel like I can't approach and ask questions and without feeling stupid. So please feel free to reach out to me, I'm sure to Cari, with any questions or interests that you might express.
Yeah, that's a really good point. Really, really good point. So many people internationally. There are so many people, people who are so great, like just so great.
It couldn't end better.
Yes.
You can find both Cari and Joanna, their trainer profiles on estillvoice.com/find-a-trainer. Has their contact info if you want to send them an email, perhaps. And you can find a course, you can find a trainer. If you are at a point where you're ready to get certified, you can do that all on estillvoice.com. That is where you will find all the resources that you need. Thank you so much to Cari Tellis and Joanna Lott, our incredible Estill mentor and course instructors and voice experts. We are so grateful that they did this. They are our first guests upon this monthly series that we're starting here across our social media pages through Estill Voice International. Next month, we will be also having 2 other United States-based EMCIs for some choral and classical Estill spin. So tune in next month, what you will see from us. We're super excited that we have launched our brand new self-guided, self-directed course, Foundations of Estill Voice Training. If you are ready to start your learning process now, you can do that. You can do that by going, again, estillvoice.com, direct link on the homepage that you can dive in deep today. So again, thank you so much, everybody, and we will see you next month. Bye-bye.
Thank you. Bye.
You're welcome.